Thank you. Good afternoon, everyone. My name is Dr. Dominique Charlot-Swilley. I am a clinical child psychologist and a faculty at the Center for Child and Human Development. Delighted to be with you here today to share information on moving from trauma and toxic stress to a much more healing centered engagement. So, the objectives of today will be to identify two developmental signs and symptoms of trauma and stress across this developmental span from preschool, elementary, middle school, and high school military students. Then we are going to talk and have you hopefully walk away with one component that shifts the perspective from a trauma informed lens to a much more healing centered engagement, which is the work of Sean Genwright. And finally, to look at two strategies for school clinicians to support military children and families across different deployment stages. So let's begin. Even the experts are sometimes confused as to which term to use. But one thing for sure, as clinicians in a school system, whether you call it chronic stress, ACEs, child traumatic stress, it really, at the end of the day, traumatized children often lose the ability to put contextual limit on things when I feel afraid and when I won't feel afraid or when I don't. How to distinguish between what is real versus perceived threat. And they really often struggle with how to differentiate their responses to perceived threat. And although some of this is typical with the developing child in terms of really operating more in their emotional brain than their thinking brain, as you know, as clinicians working with military children, there is the added layer of that experience. And so I want to start with us thinking about just Maslow's hierarchy of needs, but through the lens of the military child. And so when you think about that, and safety and security is one of the very basic needs, but there is an added layer for this child, the military child, the layer of, is mommy safe? Is daddy coming back? Is mommy coming back? Am I safe? Given that the deployment of the family member. And as we also know, often military children transfer schools 6 to 9 times, if not more, by the time that they are in 12th grade. And yet, the sense of belonging is such a critical part in the developmental lifespan. And as they're moving from one classroom or one sector of the world to another, it makes belonging, love and belonging, even more challenging. And so the stress and the sometimes trauma of that becomes an added layer for these children. So trauma is not about the event themselves, not at all. It is about the unique, very unique response that students have to the traumatic experience. What is traumatic for one child may not be so for another child. But at the end of the day, trauma certainly does negatively impact physical, mental, social, and emotional functioning, and it affects school performance. So when we think about what are the developmental signs and symptoms as a clinician to be aware of, and most importantly, to share with parents. Some parents are new to the deployment experience, some may be more seasoned veterans to deployment, but it's often really when you're in it, sometimes it may be challenging to think about What are the things I need to hold on to as it relates to my child? What are some signs and symptoms that may emerge that I need to be aware of as a parent? And so, as clinicians in the school, you're often interacting with the parent. And so, helping them just think and hold top of mind some of these signs and symptoms become very important. So let's talk at the preschool level. What tends to show up? At that level, children may feel very confused and anxious about what will happen to them. They may feel their behavior cause the parent to leave. And so a great deal of conversation is needed around that. Young children can show behavioral problems and attachment difficulties during the deployment and the reintegration period as well. And so some of the things that may emerge are difficulty sleeping, maybe even regression in some things that they've already mastered, such as bedwetting. Traumas and emotional outbursts may emerge due to the loss of control of the access to the parent, and nightmares, difficulty trusting the deployed parent. Again, important to be aware of as clinicians and share with families and parents. How does this look at the middle school level? I mean, certainly similar to non military kids, while symptoms vary, boys typically express much more anger and aggression, whereas girls are more frequently to experience somatic complaints. So you may see a decline in performance in school, standardized tests, particularly around the time of deployment. Again, that worrying about the deployed parent, their safety, leading to just really having difficulty in the classroom to pay attention and concentration problems. And you may see internalizing behaviors such as depression um, and some anxiety. At the high school level, you may see that at that point that the youth engage in more risky sexual behavior and self-inflicted wounds just to keep the military parent at home. Older children and adolescents with a deployed parent may see some suicidal thoughts and substance use as well, feeling the need now that that deployed parent is no longer in the home and the everyday management of the home, may take on and want to take on adult responsibility to compensate for the absence of the parent. So they may want to really start working and all of that. Again, really good opportunities for parents, for you as clinicians to encourage parents to have these conversations with their children. And so I'm going to shift the perspective now from trauma informed care, which I'm sure many of you, of course, are aware of, um, to a much more healing centered engagement. And just for the sake of the discussion, just a brief overview of trauma informed care. We used to say years ago when a child is manifesting any behavior challenges in the school, you would hear as clinicians when we go in the school system, teachers, administrators were saying, "What's wrong with this child? What's going on? What's wrong?" Well, trauma informed care has allowed us to really ask a different question: What has happened to you? And although this question is important, and it's important to ask, what is the behavior telling us? What need is unmet? And all of these are important. A healing centered engagement really takes it a step further. So, in some ways, trauma informed care is really incomplete. It takes it further to ask not only what happened to this child, what is the behavior telling us, what unmet need or needs are present, but what is right with this child. So it takes it that step further. Trauma informed care looks at the individual level focuses on episodic harm and injury to the harm to the individual, may focus on more that internal, using more of an individual approach, a clinical approach certainly, but rather healing centered engagement looks at it more broadly, looks at the systems. What are the systems in which the child is living that may have caused the harm? So, in many ways, it is a broader perspective in asking how is the environment where this child lives, plays, goes to school can be traumatizing. Healing centered engagement is not only a perspective, how we see young people and adults and the causes of harm, it is also an approach. How do we actually support them? In other words, it really recenters culture as an integral part of well being. It is also a strategy. It is not only a therapeutic approach, not just using a medical modeled approach, but thinking about what are, again, the systems in place that can help to address this harm, and how do we restore well being? So, the key thing is what is right with this child? It centers on repair, and put in quote resilience because that's a whole nother discussion. I think we need to think about and frame another word beyond resilience. Um, and it looks at post traumatic growth. How can you support the growth of this child? And it looks at possibilities for this child. I encourage you in the citations as part of this presentation. I provide you with numerous information, one of which is Sean Genwright work. You could find that on several on YouTube, on conversation with Brene Brown, and certainly his more recent book, The Four Pivots, that looks at really shifting perspective. Um, and four different pivots. So it's an important read. And if you are interested, I encourage you to look at that. And healing centered engagement also believes the importance of supporting adults who are supporting the youth. And one of the ways to begin to think about that is really creating spaces within the school day for reflective practice among clinicians and other members who are supporting children in the school system, and providing healing centers not only for the clinicians and the teachers but also for the parents. And so I want to offer you some questions that you would ask through the lens of a trauma informed care perspective, and questions that you would also pose through the lens of a healing centered engagement perspective. So, from trauma informed care, you would ask things like what's happening to this child specifically what happened to this child specifically to their military experience. How many different school has the child attended? All of these questions are real important to know as you're formalizing and conceptualizing the need of the child. Are there any educational gaps that may have resulted from school attendance? Um, does this child have a diagnosis that emerged from the parental deployment? Has the child engaged in any self inflicted behavior? Did this begin during the parental deployment? Very important questions to help to really begin to crystallize your approach and your plan to supporting this child. Healing centered engagement there's 5 parts to the healing centered engagement. So first, culture. What are some specific family culture practices that I can use in a school setting that will help support this child? And this becomes a really important conversation to have with the parent. What are restorative conversations that I need to have about this child's identity, especially for children of color? How how then can I engage in these cultural practices that supports this child's journey? Beyond the military experience, has this family student endured any othering or racism or any other forms of discrimination? What are some healing practices rooted in this child, this community, in not only in the community, but also in the traditions of the family that I can be aware of and bring into the classroom or into the school day to help support this child? Meaning, how can I help this student cultivate a sense of purpose and a collective engagement? What activities in the school would be of interest to help support their sense of belonging and their sense of joining? Moving from transactional to transformative relationships. This is Sean Genwright's one of his four pivots. I think all too often in the school system and in work, there's the checklist of things that we have to do and get done. And the checklist is often puts in place important pieces that have to be done, certainly. And sometimes it really lends to be more transactional as opposed to transformative. The transformative relationship really allows for pause, for creating space for intentional check ins. Later on, I will talk about the 2 by 10 relationship building, but in essence, it's really supporting the youth in helping them to begin to even identify some of their somatic responses that they are having, to be able to label it, to notice it, to identify where in the body it's coming from. These are really moments of creating transformative relationship that may not be on a time limit. And we know we are often so much struggling between time and really investing in creating space and pause for that transformative relationship. Agency. How can I support the student to claim agency of their story, of his story, of her imagination? And what are their aspirations? Asking that. How can I support you in reaching these aspirations? What is, as much as a child, a family, a community comes with a trauma story, there's also a healing story, and helping really not minimizing or brushing over that healing story, such a critical part of a healing centered engagement. At the end of the day, the path to healing is not a one size fits all. And in much the same way, when we started this conversation regarding signs and symptoms across the development from from early childhood to high school, it really is not one size fit all. And healing does happen in community. So, as much as getting the youth involved in community engagement in some form and bringing in families to have the conversation and to figure out ways in which families can support this child, it becomes an important part of the healing journey. And so now I just want to pause and shift a little bit to the stages of deployment, because we know that the stages of deployment represents another important factor that influences reactions and subsequent recommendations that I like to offer for you as educators. So let's say it's the pre-deployment stage and you're having this conversation. What are some things you might want to say to families to do? Some things that you might want to bring into the school system? Things like encouraging the family to do a videotape, to videotape the service member reading a favorite book with each child and playing in the park or other favorite places. It becomes a wonderful memory, a wonderful transitional object, especially for the babies, a wonderful transitional object for the pre-Kers, to have and hold on to. Viewing that video may help just to facilitate that sense of connection that is needed for them to feel really still connected to that caregiver throughout the deployment experiences. Encouraging a box, of course, of photographs, audio recordings, and the like, and incorporating into the student's daily routine, even when instance of communication is not possible, having them bring some of these items into school, whatever would be acceptable for the school and the family, and having it be a point of reference, something that the child can use if the child is having moments of deregulation. Having the student and the parent share a personal memento becomes an important piece again that can be served as a transitional object. During the deployment stage, encouraging the student to write a letter or draft. The email that you see before you, I'm sure many of you are aware of this, can help to set up these connections. Encouraging young children to, of course, use drawing, physical activity, and pretend games to express what they may not be able to put in words. And we know that our children, but not even the pre-Kers, even high school students, sometimes language is can be challenging. Finding the words can be challenging, but they certainly can draw it. They certainly can engage in more physical activities to get it out. Again, helping them to identify that somatic response for their bodies. Encouraging journaling and journaling their thoughts, their fears, their anxieties, and all of that. Creating a military wall in school where military children, as part of the entire school, can post photos for their service member, for their parent who is in deployment, becomes a really wonderful way of, as they're walking throughout the halls of school, it can be a wonderful checkpoint. And creating a countdown chart in the classroom, if you know and have a sense of when the family is returning, creating that countdown chart. Again, that becomes something visual for younger children. And I dare declare, even middle school and high school, having that visual countdown can be a way of helping to minimize some of the angst, the anxiety that they may be feeling. And when the family is returning from deployment, upon arriving home, sometimes the service member is so exhausted that all they could do is sleep. And that can be confusing sometimes for children. And to say that, well, daddy or mommy's home but doesn't want to be with me. And so just explaining again, taking time ahead of that reentry, of dad or mom's reentry, to share with the child some things to expect. And prior to the parent arriving, just important for that non-deployed parent to explain what can be happening and that they will take time together as a family, but some of the things to be aware of. The 210 relationship building that I mentioned earlier is really an opportunity. Well, let me step back and say this has been used a lot um, to work with students who respond well to adult attention and who are struggling to connect with peers, and also students who are having really challenges with emotional regulation or disruptive behavior. And how it works, I'm sure many of you have heard about the 210 relationship building. How it works is for you to choose that student that may be most challenging or just really having a lot of dysregulation, and make time to initiate a 2-minute personal, authentic, because we know children will know when you're not being authentic and when you are. Authentic conversation about anything that is non academic that the student is interested in. Anything that the student is interested in. And you, as that adult, Look for opportunities in that conversation for you to share something related and personal that is authentic with the student. And you repeat this 2 minutes each day for 10 days in a row. Hopefully, you keep it, it's at the same time. You are consistent each day for the student, with that student in creating that space. You ask open ended questions, you ask follow up questions, and it's a way of continuing to engage your student. Um, and what you find is often that the student will want to continue to engage beyond the 10 days. So it really is simple, but yet so effective. With high school students, remember I shared, they may engage in a lot of self inflicting behavior, substance abuse, just really not only disruptive, but really hurtful behavior. So you might want to engage in motivational interviewing and asking them on a scale of 0 to 10, 10 being very important. How important is it to you for you to change? How important is that? So for those high school students that are engaging in risky behaviors, this might be an important part of the conversation. And again, in terms of confidence on a scale of 0 to 10, 10 being very confident. How confident are you that you can change? And it opens up a conversation with the high school student. Post deployment or reunion, helping student make a sign or card for the returning parent, encouraging students to communicate to parents how they are feeling and how much they have missed the deployed parent. um, I am a big, big, big proponent of really teaching children mindfulness. Certainly, the research is clear about the impact of mindfulness relaxation techniques used not only in the school system but beyond. There are so many different um, apps that you could have a child download on their phones and the like to help support that. There are sleeping apps, all of these things that could help support again the awareness. What are they noticing in their bodies, and being able to label that, and having students create new ways to reconnect and understand if there is a disability that comes with the family that is returning home. Really create an opportunity to create space for them to understand that at the end of the day, working with military children throughout the deployment experience, it's really about being present as clinicians, because we all know, as Maya Angelou said, it's not about what you say, it's not about the words that you use, but what children will never forget is how did you make them feel? How did you make them feel? How authentic you were, how you shared authentically and created space for them to share authentically. That's what children and even adults walk away with. So, thank you very much. I hope this was helpful. There, again, a series of references that I offer you at the end of this presentation, not only in terms of references, but also other activities that can be done. Have a wonderful academic year. Thank you so much.